Hi, my name is Sheri Green, and I'm the Practice Administrator for Operations for Kennewick General Hospital's Physician Practice Group. Anyone who's spent any time managing in a practice knows that the best source of information on how you're doing is your patients. And so finding a way to regularly and reliably gather data from them about what they think about how you're doing is one of the most important things that we can do. Survey Vitals makes that easy. We immediately get feedback. We're able to turn around that information, address problems right away, and proceed on a path of being better than we were when we started. One of the neat things that Survey Vitals allowed me to do in our organization was last week to present information from Survey Vitals about how we're doing with patient satisfaction scores. So I could put up on a screen and show them in the spider diagram where we are compared to the national average for a quarter of the year, and say we've had 2,600 surveys, and this is benchmarked against 16,000 or 60,000, I've forgotten what the number was now, but it was a way for us to reflect to the hospital leadership that the clinics are a part of the organization, we care what our patients are saying about us, and we're working to improve. And our results were impressive, and so it was a way for us to brag a little bit in front of our colleagues who are really being forced to be driven by patient satisfaction numbers. Prior to coming to Kennewick General Hospital, I worked for another organization that also used Survey Vitals. And one of our challenges there was how we were going to evaluate our physicians. Many of the regulatory organizations want you to do physician evaluations on a regular annual basis, but we really hadn't found a tool that existed to do that. So we worked with Survey Vitals to put together a peer-to-peer survey that was very specific for those working in a large multi-specialty group. We surveyed employees that worked with physicians. We surveyed physicians who referred to physicians. We surveyed colleagues that they worked with within their practices, and we gathered all that data, and that became a third of our physician evaluation, those results. It was very powerful to be able to present those numbers to a provider, especially one who may be struggling with something, and say, this is the information that came from your peers and your colleagues. And between that and quality measures, it created a very comprehensive plan and program that we could run with to meet the requirements that we had to evaluate physician performance. Things that I love about Survey Vitals is that they're constantly looking to improve their product, meet my needs, and to do it in a timely fashion. I would recommend Survey Vitals to anyone who's working in a management or a leadership role over physician clinics, and I'm not sure that I would go to work in a place that didn't have it. It's that valuable as a tool to help understand what you're doing and why you're doing it.